Hello guys, and welcome again to another NCLEX question review. Our question today reads: a client has received a transfusion of platelets. The nurse evaluates that the client is benefiting the most from this therapy if the client exhibits which of the following? Option A, increased hematocrit level. Option B, increased hemoglobin level. Option C, decline of elevated temperature to normal. Option D, decreased oozing of blood from puncture site and gums. Remember that blood consists of cellular elements suspended in a complex solution called plasma. Blood is usually classified as one of the connective tissues. If we divide blood into its main components, we would have plasma, which is a pale yellow sticky liquid, and it makes up to 55% of the blood's volume. The components of plasma are 92% water, and we can also find protein, nutrients, gases, hormones, and electrolytes. Red blood cells make up about 44% of the blood's volume. They transport oxygen into the tissues. They also help with the elimination of carbon dioxide. We can also find white blood cells and platelets. They make up about 1% of the circulating blood's volume. Remember that white blood cells are the immune system cells. They protect against infections. Platelets are in charge of initiating blood coagulation. Some texts may mention the cryoprecipitate, which contains coagulation factors such as coagulation factor 8 and von Willebrand. Platelets are also called thrombocytes. They last for about 7 to 12 days. Their main job is to initiate the blood clot. Normal levels are 150,000 to 450,000 platelets per cubic millimeter. Thrombocytopenia is a condition that occurs when platelet levels drop below 100,000 per cubic millimeter. This could lead to a spontaneous bleeding in the skin, gums, and internal organs. Thrombocytosis is a condition that occurs when platelet levels rise above 450,000 per cubic millimeter. Abnormal blood clotting can occur, which may lead to stroke, heart attack, and unusual clots in the blood vessels of the abdomen. When a blood vessel is injured, a complex process of converting inactive platelets into a platelet plug takes place to maintain hemostasis and prevent blood loss. We can divide this process into three main steps. When the endothelial layer is disrupted, collagen and von Willebrand factor anchor platelets to the subendothelium. This process is called adhesion. Adhesion leads to the second step, activation. Platelet activation begins seconds after adhesion occurs. In addition to interacting with von Willebrand factor and fibrin, platelets interact with thrombin, some coagulation factors, and prothrombin to complete formation via the coagulation cascade. Activation facilitates coagulation and leads to the third step, aggregation. Aggregation begins minutes after activation and occurs as a result of turning on the GP2B receptor, which allows these receptors to bind with von Willebrand factor and fibrinogen. This process allows platelets to bind together and form a plug. A blood transfusion is a transfer of blood or blood products from one person into another person's bloodstream. Platelets are given to patients with platelet counts below 10,000 per cubic millimeter, and to patients with thrombocytopenia who are actively bleeding, or those patients who are scheduled for an invasive procedure. Remember that platelets are fragile and must be infused immediately after being brought to the patient's room, usually over a 15 to 30 minute period. Use knowledge regarding the potential uses and benefits of the various types of blood product transfusions. Eliminate options A and B because they are comparable or alike. From the remaining options, recalling that the platelets are necessary for proper blood clotting will direct you to option D. The client that exhibits a decreased oozing of blood from puncture site and gums is the one who would benefit the most from platelet therapy. Make sure you subscribe to our channel for more NCLEX question reviews. That's it for now, on to the next question.